All right, just in the interest of time, I just would like to go ahead and get started. Uh, Good afternoon, everyone. My name is Frank Nelson, and I currently serve as the Nazi New Jersey chapter president. It is my absolute pleasure to welcome all of you to our panel this evening, really to help facilitate a discussion around leadership insights as well as the operations of the financing and human element in ensuring that a healthcare organization is actually running efficiently. We have a dynamic panel that's going to take place, and we have a number of incredible speakers that are really looking forward to sharing their expertise, their experiences, as well as their involvement during their career. Just a little bit about NACI in the next couple of minutes. NACI New Jersey, our goal and our mission is to ensure that we're providing opportunity to improve the health services rendered to minority communities, and more importantly, to help with the advancement of preparation of minority leaders into leadership positions in healthcare. It is an absolute pleasure to have the engagement from all of our members, our partners in the number of organizations that continue to sponsor and partner with us as we move forward into our journey. Before I pass it on to our moderator, I would certainly be remiss if I did not acknowledge our sponsors, RWJBarnabas Health, the Atlantic Health System, as well as Hackensack Meridian, that are all institutional members for the organization here in New Jersey. And certainly the Positive Community, which continues to be a key sponsor in all of our initiatives and our efforts throughout the state. So without further ado, I certainly would like to welcome Atia, who's our moderator for tonight's discussion and who also works as the Chief Equity Officer at Newark Beth Israel Medical Center and currently serves as our leader when it comes to community outreach and a number of our efforts with bridging the gap with our community sponsors. So without further ado, Atia.
Thank you, Frank. Hello, everyone. It gives me great pleasure to be before you today to moderate and facilitate this conversation with this esteemed panel that we have before us today. Again, my name is Atia Jaharashidi, and I am the chair of our Health Partnerships Committee for NACI New Jersey. And so our objective tonight is to provide an overview of healthcare finance, operations, and human resources, and to discuss interdisciplinary approaches leading to healthcare organizations. And so we have an esteemed group of panelists here with vast experience. And so I want to call them by name and then have them self-introduce themselves at this time. And so we have Cliff Manning here with us, who is an administrative director at Newark Beth Israel Medical Center and Children's Hospital of New Jersey, and he's also an author and executive coach. We also have Jerry Tofani, a retired CFO of Monmouth Medical Center of the RWJBarnabas Health System. And then we have Sean Baptiste, CHRO at RWJBarnabas Health Rutgers Medical Group. And so if we can start with Cliff, just give us a little brief background of who you are and what brings you here tonight, and then we can go into the Jerry next and followed by Sean.
Good evening, everyone. Again, as Atia, and Atia, thank you so much for that introduction. And I also want to thank NACI for the invitation to be part of this esteemed panel. I see it as a privilege. And so I thank you all for making this opportunity possible for me. So as Atia said, by day, I just give you a snapshot. I work at Newark Beth Israel Medical Center. I'm the director for radiology here. I get the opportunity to serve our patients vicariously through our different technical imaging modalities that we have. So, everything from MRI to CAT scan, ultrasound, nuclear medicine, mammography, as well as PET CT imaging. And we also do interventional radiology here as well. So we just get an opportunity to, again, serve the community, be able to give back. I grew up around this area. And so I was that kid riding the 39 bus right up Lyons Avenue. So to be able to give back in this way, especially with the North Strong Project, it is really something that I'm very privileged to be a part of this great group of leaders that are here. So that's what I do by day. By night, as Atia also said, what I like to do as well, and one of my passions is writing. and helping other people to become first-time authors. I do have a newly published book called Dream Octane: 7 Steps to Discover, Develop, and Deliver Your Niche. I'm sure we'll talk a little bit more about it, so I won't take up too much time to talk about it now. But again, I thank you all for the opportunity. I look forward to sharing this stage with the esteemed panel that we have. Thank you.
Jerry, you can jump right in.
Tia, first of all, thank you for having me this evening. I'm a very proud member of NACI and honored to be as part of this committee. As you know, I'm recently retired. I've been in healthcare since 1976. Along the way, I was a hospital CFO for over 30 years. My last 7 years, I was a CFO of RWJBarnabas's outpatient services.
Thank you, Jerry. And Sean?
Good afternoon, everyone. Tia, thank you, and Frank, thank you and NACI New Jersey for inviting me to this panel discussion today with such esteemed colleagues and healthcare professionals and just professionals in general. As Tia noted, I'm Sean Baptiste. I'm the Chief Human Resources Officer for RWJBarnabas Rutgers Medical Group. It is a mouthful. I am president-elect of NACI, so I am a part of the NACI board. And NACI has been a part of my entire career since working in healthcare. And you know, a little about me. I'm right now again the head of HR for the medical group here at RWJBarnabas Health, and very passionate about all of the topics that we're discussing today. And I'll touch on this a little. I'm really, and this is a little cheesy, but I'm a resource to humans. I look at partnership development, making sure that we're connecting our workforce to opportunities so that they're successful in whatever respective areas that they're in. And I'm passionate about development, recruitment, and just helping people reach their maximum careers and maximum potential within their careers, and about giving back and opening up doors for people. So looking forward to our dialogue today. Again, thank you, NACI, for the opportunity, and looking forward to a fruitful discussion. And taking Cliff up on writing a book one day.
Great. Thank you so much for those great introductions. And so as we prepare to really have a really great discussion as we look at finance, operations, and human resources. And so I'm going to start with Jerry. In looking at your journey into leadership, and you've gave us numerous years of being in that financial capacity, what advice would you have for someone who is looking to learn more about the financials of healthcare for their respective roles?
There are many courses available, usually called something like Finance for Non-Financial Executives. I recommend them highly. If you are part of working for a degree, it might be a class that you can take and get credits for it. If not, there are seminars on these things. There's YouTubes. They're not that hard to find, and usually you could get the information you need. And if that doesn't work, give me a call.
We're going to put your information right in the chat, especially now that you're retired. Okay. Right. And those who are pursuing a career in finance and healthcare, what is that launching board for starting in finance? So
I would say the easiest way is to have a degree, probably like an MBA or a degree in accounting or a CPA. But you know, being a really good manager as you get farther along, no matter what your background, I think is very helpful. But you know, covering those bases, I think would be essential. Probably easiest to get employed that way.
Great, thank you. So Cliff, knowing the staff challenges and financial implications that's being observed by many, how do you keep your team engaged to deliver quality patient-centered care to the patients in our community?
I think that's a great question. It is three things I think it boils down to. I think you keep the staff engaged by setting, you know, achievable expectations. That's one. Having clear communication, and that should be consistent. and then reward and recognition. And so the expectations that you have, or you set for the team, when you communicate and reinforce to them that how that ties in, how they tie into the overall goal, it makes it easy to reward them, right? And on that last piece, I think the reward and recognition helps to undergird. It's not just a nice thing to do, but it actually helps to sustain the someone's activity. So always say reward what you want to have repeated, and that's what helps to keep the culture, I think, going in spite of what's happening around us, or even within the hospital.
Yeah, when you think about that, Sean, working in the HR field, talk to me about engagement and what that looks like, especially in the medical group.
Yeah, thank you, Tia. I couldn't agree with Cliff more around communication, culture, and especially the reward and recognition piece. It is critical, and having clear insight on the direction in which the organization is going, your department is heading, is critical. And as a leader, that clarity helps put people in positions to understand what they need to do from a day-to-day perspective to ultimately care for the patients and communities that we serve. So, I think, Atia, when it comes to engagement, some of the things that we have to focus on is as leaders is how do we allow people to be their authentic selves, right? How do we allow people to feel valued? How do we give people time back to care for themselves so that way they can bring their best foot forward to work? And that's things through competitive PTO plans. That's through looking at different shift schedules, right? But thinking a little differently. And then obviously access to care. We just are still in a pandemic, but on the tail end of a pandemic, we're still feeling it, right? Mental wellness and giving people opportunities to seek the help in which they need is critical. So as an employer, opening up those avenues and making sure that people understand truly what we offer organizationally, and what access is out there from a community perspective, and ultimately tailoring it to the needs of our people, our employees. Can't run a business without investment in our people.
Yes, that sounds very fundamental, Sean. Has it always been that easy? And tell me a little bit about your personal journey of either being a leader in that space or actually trying to work into that space.
I wish it was easy as I just made it sound. It's very difficult, and obviously, and Jerry knows there's financial implications to everything, right? But weighing what's the best opportunity to care for our patients is critical, and making sure that our staff have what they need at the leadership level down to the staff line to provide the highest quality of care. So HR, in my opinion, has transformed throughout my career, at least. And, I do think, people talk about strategic HR, people operations. It's still a work in progress, right? Of what it means to work in the human capital or people operational world and how we add value. So to that point, it's not just recruitment, hiring, firing. It's the strategy around it and helping people see things through a different lens, helping our leaders see operational issues through a different lens. So oftentimes, if we talk about the staffing crisis that's here today, right, automatically a resignation comes in, people may look to automatically backfill that same role today. Right. But let's talk about what's happening organizationally. Let's see if that's the best resource that we need for the patients that we have to serve and what's on our plates coming down the future. So it's not easy work, but it is true partnership and being inclusive and allowing for diversity of thought. And I'm a big believer in, regardless of whether you're in operations, finance, we're all in HR, we're all people managers. Right. So we have to take that partnership. We can recite laws, regulations and whatnot, but it is a true partnership.
Great. Thank you for sharing that. How about you, Jerry, in this journey from where you started, tell me about the evolution in the career opportunities as well as the impact of the financial chief financial officers.
Well, let me start with the second one. It's changed a lot, since 1976. Back then, I think we operated in a silo. Finance worked with finance and delivered bad news everywhere we went. I think a successful financial team and financial manager today has to be an integral part of the whole senior administration. I'm going to steal a line from Sean. Everyone has to be a financial manager. A way I'd rather say that is give everyone an opportunity to be a financial manager. I feel like that my success has always been by surrounding myself with people who were smarter than me. And for me, that's not hard to find. But get all these people in the room thinking, understanding what the problem was, and working together to come up with the best solution we can as a team. Not an individual solution, but a team solution. That's very true in finance. I think something that's relevant here, and something that when I had a team was always the first thing I said to our new employees is, remember, finance is not the show. The show is the care of our patients. We are not the thing. We're the thing to get you to the thing. We're a support service, so don't think you're too important. But it is a vital part of the organization. So for us to do our job, it always worked best for me if everyone in administration knew why maybe a certain project was not affordable, or something that seemed like it was going to be affordable isn't affordable now. Or in tough times, like I think we are on the verge of, well, we may have to make some difficult decisions. Let everybody see the problem. They may see a solution that myself or my team doesn't see, or at least know the urgency of what it is we're trying to achieve. So I'd say the biggest evolution, and it's a good one, is that we are now, part of the team. I think a strong financial manager, in the old days just had to know finance, and pretty much was a pretty gruff person, and lack personality probably was a detriment. If you appeared soft, people try to run over you. Now you need good interpersonal skills, good management skills. I would say that's the main difference.
Yeah, I totally agree with that. And I know when people are moving into leadership or are growing into looking at the operations of an area or a department, there can be a lot of different challenges, especially understanding the finances and the roles there. So Cliff, talk to me about your journey and your current operational role and how those intersections with human capital and your budgets and everything else intersect.
Yeah, so I really think that it's so interesting to have us talk about operations, HR, and finance, because they sound like they're disparate groups, but they're actually all like, it's one organism, right? Like, so like we all have different parts in this organism. And if I look at just the operational side, in my journey, just starting out, it would say, you have a physician, for example, go to a conference, and they'll see the boondoggle that's being the shiny object at the conference, and they're like, we need this thing, because we're going to do all of this work. Well, you need to balance that. Like, they have to, you got to sit down with finance and see, like, what's the return on the investment in this product? Like, is it something that's going to be that we if you build it, they will come type of thing? Or is it something that, you make a small investment and it actually will have a return that benefits both the patient and also the institution? So finance ties into that. And operationally, when you talk about like HR, human capital, the reward and recognition, but on the flip side, you have coaching, and you also have, counseling that needs to happen. So there are tough conversations that you need to have. If that's not navigated properly operationally with HR partnership, something could be said or done that down the road you could have a disgruntled employee that comes back and sues the hospital. So now you see how you need your partners, because that bad decision or misplaced decision that could be had in that moment when you're meeting with an employee, again, HR will help to prevent a financial impact down the road. And so we all work together. I think we're all one organism. And in my journey, that's been the evolution that I've learned by working over the years with these different groups.
Mm-hmm. And Atia, can I just add to that, if
Absolutely.
You don't mind?
Please.
Because you hearing the panel, it's and it just brought me back to a place of team-based care, right? So you look at on the clinical side of the house, you have the PCA, the doc, the nurse, whoever it be caring for the patient, and all are responsible for the outcomes, or at least the care delivery of that patient, right? It's no different on the back side of the house or the administrative function side of the house, where it is that team-based concept, and we do have to understand how financial decisions, operational decisions, human capital decisions have positive or negative implications to how we deliver care. So Cliff, when you were just talking about that, it brought me back to relating to the same team-based care from a clinical perspective.
Mm.
Thank you for adding that. And I'm going to ask you to continue a little bit, Sean, when you talk about the engagement in human capital and really having the team. How do you, or what do you suggest people do to continue to thrive and avoid burnout? I mean, since we've had the pandemic with the challenges in our marketing for staffing and such.
Yeah, I'm gonna take this from two angles, from the employee side and what we can do and what we can control, and also from the employer side, what we should be doing, or at least what I think we should be doing. So automatically, and I've heard, people are doing a lot more than they traditionally did 2 years, 3 years ago. We're doing more work. There's more work on our plate. I want more money. I want more dollars. Compensate me more. So, and obviously, regardless of the size of your organization, finance is, we don't have a blank checkbook, right? So there's other things that we can do organizationally that allow for people to grow. And Cliff touched on it around workforce development plans and partnerships with schools and universities or different communities like NACI to join that will give you access and learning opportunities so that way you can advance your career. So as an employer, employers definitely have to take a seat back or a step back to look at what are additional ways to invest in our staff, invest in our employees. And from a personal employee perspective, me being one of them, you have to have a relationship with yourself and invest time in yourself. However you do that, you need to take a step back and think about, if you have an engagement candle, an internal engagement candle, what are those triggers that make that flame burn higher or dim? And take time to focus on yourself in reality. And that could be getting access to EAP services, that could be going for a walk and exercising, that could be going out with friends and reading a book, writing a book. But it's critically important that you take time to decompress. Utilize your PTO. Don't save it up for when your organization pays you out, right? Because then you're just burning yourself out, and the dollars might be great, but the impact it's having to you in real time is you may not notice it, but it may be harming you or not helping you reach your maximum potential. So recognize, what I try to do and remind my team is recognize that you're probably burned out. And when you're feeling something throughout the day, take that 5-minute walk to step away from the computer, and go find time for yourself, and do what makes you happy. I know that's a little cheesy, but it's real. We have to get back to the basics to avoid the burnout, and ask for help when you need help.
Thanks. I see Jerry nodding his head. Is there something you would add to that?
No, I think Sean said it. Don't wait until you feel burned out to start doing that. Do it prophylactically, do it preventively, and be your best self.
Yeah, one of the things, according to the Bureau of Labor and Statistics, we've seen major financial changes over the healthcare industry for the past 2 years. Labor is up 19%, supply 21%, drugs 37%, and nursing costs by 39%. How can we ensure optimal care while being fiscally responsible in climates like this, Jerry?
T, I wish I had better news for you right now. I've got bad news and I've got good news. The bad news is, over the years, I've seen several periods of financial difficulty for hospitals and healthcare systems. The good news is, eventually they always came out of it. Now, it wasn't overnight and it wasn't easy, The bad news again is I'm concerned that we are about to enter into another one of those periods. The financial situation for hospitals and healthcare systems is a reflection of our economy, the world economy, which is not in good shape right now. So to put it in simple financial terms, in essence, the finance department has to make sure we've got the money to pay the bills. And there's a lot of ways to do that, and I can go in a lot of detail. But now when you see the numbers you just quoted, which are far in excess of the revenue, the amount that the revenue has come in, it presents a very difficult situation. I would say over that same time period, revenues have gone up maybe 6%. And, listen to the numbers you're talking about. So you've got, money coming in growing at 6% over 2 years and money going out growing in double digits. That's not an easy situation to handle. So it's time for, a lot of focus. It's time for some ingenuity. It's time for a lot of teamwork. There may be some strategy where you decide you're going to go negative for a little while, but how long can you do that? Because as we've all said, the most important thing is the care of the patient. That's got to be first. And then, you can't do it without employees. So there's really no easy solution. So I wish I had the magic bullet. I don't. Some things to consider. Medicare, which is based on regulations and laws, pretty much sets the tone on how much the insurance companies are going to increase our rates. The others sort of fall behind it. They're only offering 2.5% for next year. And my understanding is that overall, big systems are spending about 9% now more than they did the year before. And there's no reason to see that will decrease. It's still going to be hard to get employees. Still going to, supply chain shortages are going to continue, and the prices of supplies are going to skyrocket. Some things that haven't increased are going to, like utilities. So I hate to be the bearer of bad news, but I think, we need to be realistic. So we need to work together. We need to be creative. We need to have a little bit of ingenuity. There may be consolidations in the works. We may have to eliminate some services that seem necessary, but maybe aren't as necessary, sort of triage the services. I have to say, since 1976, there's never been a time when we had enough money. There's never been as much money as everyone wanted to spend. And that's okay. I mean, I don't want to sound smart about that. But back in the 80s, early 90s, if you could differentiate between what you needed to have and what you would like to have, you could get by. Well, in this century, and especially in the last 10 years, that no longer works. If you get rid of all the nice to haves and focus on the must haves, there's not enough money for that either. So, old finance would cut. Now, there's no excuse to not be lean, but you can't cut your way out of this. I mean, if you already don't have enough staff, you can't cut staff, right? You have to find some things that aren't necessary. It's not easy to do. So maybe there's some mergers, acquisitions, things that are more profitable than, say, a hospital that can help you. You're going to have to look at things like that. There is no easy answer, but the bright spot is we always come through. Something to consider is Medicare and Medicaid, even though governed by regulations, is very political. And I'm not a politician, but I know people that are good at it can somehow convince politicians to give more money when there wasn't there, in the first place. So we need to lobby hard. Second, the rumor is that the insurance companies have been unusually profitable. And that's because during 2020, 2021, the hospitals were full of COVID patients and not much else. So people weren't spending as much on their healthcare as they usually did. So the insurance companies, although they collected the same amount, didn't lay out as much money. Okay. The second piece of this, I'm sorry, is going to sound morbid, but it's a fact. Hospitals and healthcare systems have always had what we call our frequent flyers, right? People that are chronically ill, very sick, use a lot of our services, and appropriately so. Okay. Unfortunately, many of them did not survive the pandemic. So these frequent flyers, which cost the insurance companies a lot of money, there aren't as many of those. So long story short, insurance companies supposedly, especially in areas which were more, more vaccinations took place than in other places, haven't had as many sick people, asking them to pay their bills for them. So I think we need to, really negotiate hard with them to give us more than their usual increases. I think that would be a solution. But again, I'm a few months removed from this. I'm assuming that the terrific leaders we have in all of our systems are working their way through it. I'm very curious on how they're going to approach the budgets. But it's again, having always been the bearer of bad news, if I were ever to come out of retirement, I would probably sell ice cream or do something that people are happy to see, or not say, oh no, here comes finance, we'll never get this passed. But you have to give the bad news when it's what's happening.
I love ice cream, Jerry, and I promise you, I'll be right next to you, braiding hair on the beach and painting seashells.
Give me a call afterwards. We'll work that.
Absolutely. And so what I hear here is we're really talking about creativity and being really innovative, not just personally, professionally, but institutionally, right? That we have
Correct.
to look across all boards and be very innovative. And so I'm going to change gears a little bit as we talk about innovation and really looking at personal and professional development, and to talk about your book, Cliff, and to bring that into and around executive coaching and leadership, because it has to be a struggle to think about these very hard decisions that we have to make as leaders. And although it's a strategic plan to make sure that the facilities are viable, we also understand that there are some losses of human capital and structures and programs that are affected. And so talk to me a little bit about how leaders could be supported and what your book does to really tap into some of the niches of leadership and personal growth.
Yeah, thank you for that. So if this part of the conversation sounds like I'm a 9-year-old on Christmas Day, it's because it's my passion. All right. So, I think about, what started out for me, the journey of beginning with Dream Octane. It started with me being in business school. I was in the executive MBA program at Rutgers University. It's our last semester, right? So our professor, who is the director of the program, started teaching us the 6 steps that countries would do back in the 1800s to improve their overall well-being. And he started going through these steps. They would start with finding what they had in abundance in that country. They would then see where's that abundance used intensely. They would then find out what's their comparative advantage or what they can develop efficiently. They'll specialize in that. They'll also eliminate trade barriers, and then they will also find another country that has scarce what they have in abundance. And that's how trade happens. And I started sitting there in class. Here I am, last semester, somewhere in the back of the room, and instantly my mind was like, wow, if countries can do that with all their complexity, like why can't an individual do that? And that's how Dream Octane, the frame for it, the infrastructure really came out of that. Instead of it being 6 steps, it ends up is 7 steps. So the question is, okay, so what does that have to do with leadership? How does that apply to executive coaching and so on? Well, the transition of that is that I believe, and I've seen it on more than one occasion, is that we all have a story to tell, right? We all have something that we do extremely well. We see this on display when we see someone going up to win, they just won an Oscar, an Emmy, a Grammy, or whatever. Pick any one of those. And there's always some story, some family member afterwards that can be like, you know what, that Grammy that they won back when they were 7 years old, they used to sing, and we used to always call it, hey, come out here and sing for company. They had that thing, that it, before they even won the award. And I believe we all have that. I believe we all have something buried inside of us, but not everybody knows how to either navigate to it. And if they do know how to navigate, they may not know how to excavate it out. And so Dream Octane, when you look at the book, it really is it looks like you're going to read a book about mining for oil. Well, the oil that I believe that we're mining for is the resource inside of each one of us. So if you can find that thing, you can develop it in the refinery. And the refinery is just simply taking what you have as a crude resource, refining it by serving others with it, meaning you're giving somebody else this thing that someone would normally pay for, but you're doing it for free. Why? Because you're developing that product. That's the refinery. You eliminate the things that could stop you from moving forward. And then you go to the very last stage, which is delivery. That's when you take that crude resource that was in the ground, you discovered it, you now refined it in the refinery, but now you're getting it to the pump. Why do you want to get it to the pump? Because I believe if innovative change is an engine, your unique dream and ability could be its fuel. And so if you get it to the pump, now you're bringing what you have already served on step 4. Well, in step 6, you're going to bring it to a wider audience. Now you start charging. That's how you get to the executive coaching standpoint. And then step 7, there's a whole process that we go through with step 1. Step 7 is just simply asking, do you have more to give? So you're not commoditized that first thing, but you may have more than one thing. But you got to start with the first thing. You got to focus in on it. You got to specialize in it, and then you deliver it, commoditize it. And so that's how everything kind of comes together. Sounds a little complicated, but it's very simple.
No, I actually love that analogy. And when you think about crude oil and the process of refining, and you compare it to leadership, and you look at the arms that we're looking at today, the operations and finance and human resources, it really gives a lens to how to support our leaders, or what type of backgrounds and coaching and support we might want to offer and have available to our leaders. And so, Sean, I'm just gonna go off a little bit to ask about that type of support in a human resource area for our leaders. We have leaders across the board here attending this panel, and maybe we have someone who is an executive coach or needs an executive coach. Talk to us about where human resources plays a part in that.
Yeah, that's a great point. And I wanna clarify something from my perspective. And you could agree to disagree, but I think there's a difference between leadership and management, right? And you don't have to be in a hierarchical management role to be a leader, and I think sometimes, certain people, or some people who haven't stepped outside of their comfort zone yet, hold back because they feel they need to be in a position of power to lead people. And I think this is where good management, what Cliff was just talking about before it gets to the executive coach part, comes out of tapping into that individualized person's skill set and what their intrinsic and extrinsic motivators are, and identifying that as a leader and pushing them to pull it out, or having the ability to pull it out of them as a leader. And see, that's where strategic HR functions help leaders develop the skill set to identify that in their people, regardless of what discipline you sit in. And then when you get into, as you continue to move up the hierarchy, or you get into managing multi-layers of people, so you may have 3 direct reports, and that direct report has X amount of people under them, your leadership presence and how you walk into the room, how you demonstrate your core values organizationally is critical. And there are professionals out there. You could pick up this book. I will order and read it, Clifton, because I think you brought up some great points. But there are professional organizations. I know Rutgers has a good executive program. Seton Hall does as well. They're in their schools that you can go to hone in on your leadership competencies and skill sets. I do think it's critically important that you also have cultural sensitivity and cultural awareness, because as I think Cliff said it, I don't know if it's Cliff or Jerry, but everyone can write their own chapter, write their own book, right? And in terms of life, and how someone manages me is going to be different than how someone manages Atia, and that's okay, right? So as a leader, you have to take the time to invest to find out your people, who your people are on your team. And again, as an HR professional, and how I operate with my colleagues is, and I said this earlier, I have them look at things through a different lens. So my communication with them is helping them understand their people. so that way they can lead their people to reach our operational goals, our financial targets that Jerry and his team are setting, our patient engagement scores and satisfaction scores. But that comes through partnership and understanding what's going to motivate my leader and help relate to them, so that way they can roll their message out in their own respective way, not Sean's way, but Frank's way, or L'Oreal's way, right? So you have to tailor the messaging to them and help them see through a different lens and sharpen their skill set and have those tough conversations. Again, I don't recall who said there's tough conversations that need to be had, but that's all part of the leadership development process.
Great. This has been such a great conversation, and I want to get ready to go to the Q&A section, but I'd like for you to have some words to part with for our esteemed, for our guests here tonight from the esteemed panelists. So I would want to ask you one question. I know I didn't prep you for this, but in your field of work and in this setting here at NACI, tell me your connection to NACI and how you leverage or see to be able to connect what you do in your role to build up the leaders in this platform today. Starting with Cliff, tell me about what you can bring to NACI and why you would be here and what others should see in it as an operations manager.
Yes, thank you for that. I think that there's two connections. One, I find that NACI is a great organization. As I came, to see, you helped to introduce me to NACI, and from the time that I've been coming on the conference calls and meeting Frank and many of his team members, it is something that that shows me that this is an organization that focuses on not just doing things to be doing it, but they're doing things with purpose and intentionality, and they have a heart to serve others and to help develop others in ways that, having a conversation like Jerry brought up or Sean brought up, where we don't even, like, as they were sharing, I was like, wow, that's such a great point, what they're making. And it's a perspective that I don't have, right? Like it's something that you need to have these different parts come in and share it, so it can give you a broader focus of what healthcare is all about, what leadership is all about, and how you can fit into that process and become the next leader in your specific niche or your specific area, because we all have that opportunity. Once problems present themselves, it gives us an opportunity to think and have innovative solutions to help solve those problems. So that's where I feel I can work with NACI.
Thank you, Cliff. How about you, Jerry?
Okay, so how did I get here? I like
You're our
to
best
help.
friend.
I hope I'm more than a friend. I hope I'm an integral part. I like to help. As I've gotten older, I like to mentor, although it's been pretty much informal. It turns out that a few of my better mentees belong to NAHSC. They suggested I join, and I was happy to join. A book that I read that helped convince me to retire talked about what's important for success and happiness in the later part of your life is one, to have a purpose, two, to make good friendships. So I need a purpose. Considering what's going on in the world socially, I thought this was a great opportunity for me to have a purpose, satisfy my passion to mentor. And so far it's met, it's been everything I hoped it would be and more. So what can I add, as I have sort of stepped away from my, 60 hours a week of doing healthcare finance, I'm still sort of in touch. And, I'd like to be available to this group but not only just talk about finance, but management, career development. Again, as we discussed before the meeting, I'm blessed with 6 children and so far 7 grandchildren. So mentoring is a big part of that. And I feel like you're all an extension of my wonderful family. So hopefully I can help in that way.
Yes, and those who weren't on the call at the very beginning, the first thing that Jerry offered was mentorship. If you can't find it outside, just pick up the phone and call me. And so we can appreciate that, Jerry.
I'm
How about
sincere
you,
about
Sean?
that.
I know you are.
Yeah, so as I said in my opening, Nasi's been a part of my healthcare life since I started. So I'll start there. I was a fellow at an organization up in Boston, and one of my mentors told me about Nasi. And I ended up helping revamp the Massachusetts chapter when I was there. But I went to the national event, and it's typically in October. And I believe that year it was down in Miami. And as a fellow, being in a healthcare system that was predominantly run by white men, I went to this conference, and I saw myself, my family, and people in very powerful but also reputable organizations across the entire country, and the passion, the brotherhood, the sisterhood, the feel, and just the natural ability to help people. I was instantly glued. And then for family members like Jerry, who were in powerful positions that come in and lend the helping hand to open up, mentor, I was like mind blown. So it's been a part of my being in healthcare since I started. And it will continue to do so. And I recommend and try and encourage people. So if you're not signed up, sign up. Join the familyhood, because like Cliff said and Jerry said, we all have unique experiences within the healthcare arena and the professional world that we should be coming together to care for New Jersey, regardless of your organization. Right? There's a lot of unique experiences that we have that we can build off of that will help us in our respective areas and grow professionally, but also that we can bring back to our organizations to make New Jersey healthier and provide better access. One of the things that I bring to the table is another connection in now your professional world, that you can call me up, you can email me, and I will help you connect the dots, connect the links, build a relationship, just talk. Right, and bounce ideas off of another. You know, I met someone at the Nasi conference 2 years ago. I'm doing some, doing some project work right now. I called him last night, and we're still connected based on an organization he's running down in Charlotte. So this connection really becomes a family, and we need to capitalize that, because we're all here in New Jersey. You know, so that's what I bring. I help to be that integrator and connector to everyone here.
Thank you. Thank you all. I have a few questions in the chat that were sent directly to me, so I'll ask them for the people who have questions. And this is for all of the panelists. What are the biggest current and future threats to the healthcare industry? Go ahead, Jerry.
So again, in the bad news portion, right now financially, like the economy, we're not in a good way. So I'd say that's a threat, but not to give Cliff any more of a plug than he needs. You know, the thoughts he brought forward from his book, I think would be a great way to generate a lot of the ingenuity that, as you've mentioned, Katia, that we need. So, you know, that's where the hope comes. But right now we got to take care of the finances.
Great. Anything, Cliff or Sean, you want to add to that? That was for every panelist.
So I think one of the number one things that you know that we're up against is people feeling unqualified, and they may have more resources to add to a situation or to their given environment than they may believe they have to offer. And I think it also, I also do a podcast, and I speak to experts about how they found their niche. And it is surprising to me that these incredible people who have achieved great levels of success, when I ask them like what internal struggles do they have, about 80% of them say, I didn't feel qualified. Very successful, and they said I just didn't feel qualified. They were honest about it. And I think that truth is more prevalent than we may be transparent about, or may let on. And so I think if we can just see that, again, we do have value. Maybe what you have is something that is unrefined, and it just needs to be refined or teased out. But it is something that can help the environment that you find yourself in, and you can make a difference. We just got to be intentional about finding that thing and delivering it in a way that can be helpful to others.
Thank you so much. And Sean?
Oh, yeah, sorry, I'll be quick. I was just gonna say, I would marry the two from my perspective, finances and the people. You know, I'm concerned about, one, what Cliff was talking about of people feeling underqualified, undervalued, undercared, and then the innovation that needs to happen for healthcare executives to think differently on how we care for our patient. And that's where the innovation and diversity of services comes in and employment models. But all that, you know, finances plays a big part, but access to care and the mental wellness and how that looks at from an employer perspective, and the training and development that's needed. People have choice nowadays. So we're no longer, healthcare workers, as we all face, are no longer competing with other hospitals and medical groups. Our competition has totally opened up.
Those are very great points, especially when you talk about the mental well-being of our staff and our leaders there. And so at this time, I'd like to open it up to anyone who may have questions that you didn't put in the chat. You might want to raise your hand. Yep, I got you.
Yeah.
Wolverine.
Yes, good evening, everyone. You know, I guess, you know, I'm a physician and my focus right now and passion is on patient engagement and cultural competence. I do this consulting work. And I just want to thank New Jersey NASHI for supporting some of my statements I have on LinkedIn concerning health disparity and also patients with sickle cell disease who have the unimaginable physical pain from the crisis, and then the mental and emotional pain of being called a drug seeker. And it's not supported by medical literature. They're the least addicted for individuals requiring pain management. But I just want to reach out because of that's what I'm in. So Jerry, you mentioned about frequent flyers, and I just want to make a statement about it. And this is from talking to about 1,000 patients, with a big chunk of those, not a big chunk, a portion of those patients were labeled as frequent flyers. And what I found is that, and you could think about this, using the word non-compliant, you've heard that word all over the place, right? About 20,000 times. But how many times have you heard why? So we don't know why John Brown didn't follow directions, but we're going to refill the same prescription he didn't take and then call him non-compliant. And I think non-compliant written in the medical records like 3 times, that person is under the health bus and nobody cares about them. And I have a feeling, I can't prove it, but just from talking to different patients, I think we have turned the quote non-compliant patients without asking why into quote frequent flyers, because they have to now navigate the system through by themselves, because once somebody looks in the record and see non-compliant, and we never ask why. And I think that's something that creates health disparity and poor health outcomes. And just a quick,
Thank you, Dr. Beverly.
May
I see your
respond?
hand up, Jerry.
Maureen, Dr. Beverly, I certainly hope that I didn't choose the wrong term there and used one that turned into a disparaging remark or sounded like condescension in describing a group. I would never generalize like that.
No, I know you didn't. I'm just saying it's a regular word. It's not you. I'm just you in the system. So it's not, I didn't take it from you personally, but you hear it a lot of times. And so that's what I just wanted to put the correlation with possibly non-compliance.
Okay, and you have a thankless job and we all appreciate what it is that you do.
Yeah, and I thank you for that comment, Dr. Beverly. Of course, too, Jerry mentioned it about leaders understanding the why for strategic thinking, and it plays with both hands for us to understand the clinical why of why our patients do and respond the way that they do as well. So sometimes it is the response and not the action. There's a question here in the chat. What advice will you give an aspiring healthcare executive leader who is seeking a mentor or trusted source to speak about unique experiences for professional development? and there's a little bit more to this, so give me a second. I just have to scroll down. A special focus on one who is self-proclaimed an introvert and not skilled in putting themselves out there. Anybody want to take that one? Go ahead, Jerry.
Call me. You know, NAHSC has very good mentorship programs, but if you tend to be an introvert and maybe don't want to be part of that setting, again, you know, you don't have to write a fancy letter or anything. Send me an email and I'll be happy to call you and work with you.
That resonates with me. People don't believe that I am an introvert. It's my years of experience that gives me this outward appearance. But I'd rather call you up, Jerry, on the phone than to really speak out in a space like that.
Yeah, I think socially, well, I tend to be more hermit than social, but professionally, I have to, you know, balance it out. So I understand that as well.
Absolutely. Sean, you were going to say something?
Yeah, I was going to say, and I'm believe it or not, for an HR person, I'm an introvert as well. Very much so. And, you know, I would say, you know, you have an avenue in to executives and multiple different avenues of the state through NACI. It's a good way to connect, like with Jerry, myself, and I don't want to offer anyone else out, but I know they would be open to it, to get our information and just say, hey, I'm interested in X, Y, and Z, and we'll reach out and connect you with the right person. But that's the good thing about NACI. It's how I've grown throughout my career, in all honesty. We're through some people who were highly affiliated with NACI. And, you know, I wasn't going to the national conference collecting 1,000 resumes. You know, I sat in the back of the room and made my notes and tried to make avenues in. And then through my career, I've learned how to balance. So there's opportunities to do it here. And for us to help connect you to the right person that can help you benefit and satisfy what you're looking for. But that goes for anyone, not just the person that asked the question.
Great. Or are you going to say something, Cliff? I'm sorry.
Yeah. So I think it's a great question. I think that it's a lot that's in there, and it kind of took me back to leadership and how, when I was growing up, what I kind of heard what leadership was all about. And there's some truth to it. I mean, I heard that, you know, leadership at times, you know, could be, you know, you have a talented individual that's able to do certain things a certain way and get a certain outcome. Like they kind of use the talent as the leadership description, which is, I guess, some truth to that. Or you may hear that the leader is tenacious. You could be a type A person. It could be they're going after things. They're relentless. They're going to make it happen, right? So that tenacity comes in there, and both of those are true. But I think what it really boils down to, whether you're an introvert, whether you are an extrovert, or anything in between, I think leadership is more about timing. I think leadership is more about timing, and when I say timing, I mean when you can look at a great need and you connect a great resource, and you can be that resource. That's when leadership happens, right? And leadership is actually it actually rises out of situation, right? It's, you know, when something needs to happen and you got somebody that's saying somebody needs to do something, guess what? They could be the leader for that moment. So if you have that passion and you're like, somebody's got to do something and nobody's doing something, you could be the one. So, you know, just like Sean and Jerry offered, you can always reach out to me as well. I'll put my email in there as well. If you want to hit me up on email, got questions, I'm glad to help in any way that I possibly can.
Yes, this is wonderful and a wonderful conversation. I'm not sure if there are any more questions. I didn't see any more in the chat. Let me just take another look. Give me a second, guys. I don't see any more questions in the chat. And so as we close up the panel discussion, and before I introduce the next person to talk a little bit about our membership and how you can really be involved, I just want to thank this group of experienced, esteemed panelists for sharing some insight around operations, finance, and human resources. We've heard where all of these things, all these areas intersect and really shine some light on what it is to be a leader in this area. So I do want to thank you all. If there's one thing that you would like for someone to take away with them today, what would it be, Jerry?
In troubled times, there's opportunity. Okay, so think positive. Try to take advantage of these opportunities, and also to touch base on something Sean just said. You got to lead with example. So go out and give a good example.
Cliff.
Sure. I think that, one of my favorite quotes is, a mind that is stretched by a new experience can never go back to its old dimension. Right. Oliver Wendell Holmes said that, if I'm not mistaken. And so I think that as you invest in yourself, as you invest in your mind, as you go to great leadership conferences, as you get great mentors, those are going to be things that's going to take you to a whole nother dimension. I like to see our ambition as being the ceiling, and our focus and faith helps us to push us to that ceiling. But eventually you'll have that ceiling as you develop yourself. That ceiling will become your floor. And then now you have the ability to be the resource to pull somebody else up who's below that ceiling that you once were, and help to pull them up to that new floor, right? So it's all about helping yourself to rise by investing in yourself, and helping others to get to where you have now come from, because you know the journey. And so that's what I'd like to leave with.
Okay, and Sean.
Yep. Management and leadership is different. Leadership, as Cliff just mentioned, doesn't require a title. And I'm a quote guy too. So the great late Kobe Bryant said, "It's the magic within each of us that gives us the potential to inspire the world." Go out, help people, each one teach one, give back, help your brothers, your sisters, go inspire the world, and you'll find some fulfillment within yourself and your career. And I thank everyone for the time today, and Jerry and Cliff, thank you, because I have a sheet full of gems here.
Me too, Sean. I've been writing notes since we started, and so I can appreciate all that you all shared today. And I'm going to say that I was inspired, and so this is quite magical what we brought together here today in this discussion. And with our, we'll have more information as we bring this back to our president, Frank Nelson, around membership, how to get involved, and really thanking our our institutional partners, RWJBarnabas Health and Hackensack Meridian and Atlantic Health, for really being a part of our institutional partnerships. But we also would encourage our individual membership, because you tap into the wealth of what you have seen here tonight. It's just such a great opportunity to be involved in NASI, New Jersey. And so I'll hand this back over to you, Frank.
Great, thank you so much, Atia. And I cannot be any more proud and really thankful for the discussion that we just had. As I'm thinking about some of the key terms around purpose, internal fire, and really the magic within, and essentially really going out and being a leader, which is very much different from management. I could not be any more thankful from all the gems and all the information that we've gathered thus far. So I really, really would like to thank all the panelists. This was such an incredible panel, a very dynamic discussion, and we're so incredibly thankful for that. In closing, what I will say is that membership for NASI New Jersey is ongoing. One can have an opportunity to become a member at any given time. We do have a membership chair. I believe Moses just shared the information to our chat here. So please feel free to reach out to any of us. We'll make sure that we can connect you with our membership chair to become a member, should you want to do that. I remember someone asked about mentorship. We are rolling out a mentorship initiative to really provide an opportunity for our mentees to be connected with mentors all throughout NASI, New Jersey. The first cycle just is starting in 2 weeks, and within the next few months, we're going to be rolling that out and expanding that to other members. So there will be a lot more opportunity really to be engaged and serve as mentors as well as mentees, and for you to connect and really learn about healthcare management and really understand the different pieces that are actually part of that. In all, I think the main purpose of tonight's discussion really was to get us to have a better understanding of leadership and understanding of the different elements that are really important for us to drive efficiency and operational excellence within a healthcare organization. And we understand that we have some challenges all throughout the healthcare industry. However, to the points that were made earlier about creativity, collaboration, having intentionality around understanding the finances, understanding the operations, understanding the human element, and valuing our team members, we understand that ultimately these are some of the things that are going to help us become successful and continue to care for the communities that we serve. I'd like to close out by saying thank you to all of our members. We are so thankful that you decided to join us. We have a number of other events that are being planned, and we look forward to your continued engagement. And just want to say thank you. Have a wonderful evening, everyone. And we look forward to seeing you again in future events.
Thanks, Frank.
Thank you so much, Frank.
Thank you. Thank you, everybody.
Thank you, everyone.
Thank you, everybody.
evening,
Look to
everyone.
see you in the membership.
Thank you.